At Cysters, we work with women, not just for them. Every voice matters. Every experience shapes the work we do. And we can only do that by working together with researchers like you. Today, you'll hear about research, interventions, recommendations, but most importantly, you're going to hear the voices that shape them, because together we can move beyond tokenism to research that truly works for everyone.
I'm Kath Grimley, Research Fellow on the Access for All project at Warwick Medical School.
I'm Beck Taylor. I'm a Clinical Associate Professor in Public Health at Warwick Medical School, and I lead the Access for All project. Working in partnership with Cysters, we see what meaningful engagement really looks like.
Their insights highlight gaps and successes we wouldn't see otherwise. The women's perspectives challenge assumptions, help us to design research that actually works for communities.
Cysters show us that co-production is not a checkbox. It's a relationship built on trust and respect.
Trust grows when women are listened to and involved at every step of the research.
I think when we apply research is from a very academic lens, but without the voices of the people who it's actually going to benefit. And when we don't include them, we don't include their voices, their opinions, perspectives, they're never going to engage with services that were never built for them.
My name is Amira Hadi.
I'm 35 years old.
I'm 24.
My name's Neelam Hirashergil.
Kaylee.
I had endometriosis for almost 3 years now.
Had a medical menopause.
I'm living with stage 4 metastatic breast cancer.
It's been over 10 years where I've been suffering with painful periods that I would thought were always normal.
As someone with muscular dystrophy, a progressive muscle wasting condition, and a wheelchair user, accessibility is something that I have to constantly navigate.
My health journey started when I was 14 years old. I'm 37 now, and I started off with having severe bad periods, vomiting, and I was always told that I would grow out of it, and still now haven't grown out of it.
At the time that I had my daughter, black women were 5 times more likely to die during pregnancy and childbirth.
It took me around 10 years to get a diagnosis, and I feel that was only the case because I ended up going private.
It has taken 20 years to get a diagnosis of endometriosis.
I lived with undiagnosed cancer for quite a few years. It was appendix cancer in the end, and it was very difficult for them to tell what it was from the outside until it spread everywhere inside me. And I had a lot of being told that it was nothing.
From the very first period, there were major red flags there. And I actually got my first period on a school trip. None of them flagged to me that this might not be normal.
That continued to be a pattern in my life where I'm thinking, okay, this pain that I'm dealing with is normal, despite it being anything but normal. And then getting older, getting married, and then having your sex life be completely ruined by the significant pain that you're in.
So, hang on, I'll go through the medical menopause immediately, right? And his answer was, oh yes, but I think there's a cup of tea for that now. I've encountered a lot of not being diagnosed, misdiagnosed, misunderstood, not believed. And I went undiagnosed for nearly 20 years.
I was given a diagnosis of PCOS and fibroids from my GP and kind of sent on my merry way. I wasn't given any information.
I've had a really, an array of experiences with healthcare professionals, from not being believed to being gaslit, but also being told that it's in your head.
I had to self-advocate relentlessly, preparing my own notes before appointments, documenting my own medical history, and chasing doctors and secretaries with no response.
A lovely consultant will tell you that in 3 to 6 months, you'll be fine.
When I was a teenager, all of my symptoms were brushed off as normal. I was bleeding through their pads every half an hour. And I was completely bleeding all over my clothes and all over the bed and all over the floor in the bathroom.
I had to keep pushing GP to listen to me.
I waited 5 hours in hospital, crying in pain lying on the chairs.
Another barrier that I would say nearly every disabled person who is unable to transfer faces is a lack of hoists in getting tests, for example, smears and ultrasounds. On the rare occasion that one is available, I've found it isn't charged or not properly maintained. This means that I always book appointments when someone who can lift me is available to come with me.
You're given the referral, but the referral never comes through. You're still living it. The pain carries on day to day.
And then they'll say, oh, you need to be seen within the next 2 weeks or 5 weeks. 6 months later, I've not heard anything from anyone.
Being told, I'm sorry, your cancer's returned, and then having to wait over 60 odd days before I got my first appointment. I think that deadly silence for all those months waiting to see my oncologist, it's the hardest part of my journey. I'm not going to surrender and hope to be here for years to come.
The gynaecologist basically said that he thought I was just too petite for my partner.
Through language and attitude, medical professionals questioned my right to be there, being made to feel like an inconvenience, and I don't belong during a gynaecologist appointment in a space that I was most vulnerable. I've had to fight for my dignity and right to take space as a disabled woman.
Women who are sort of neurodiverse as well, like, going through sort of endometriosis. I think it's so hard to being your own advocate.
You really do get brushed off. And sometimes I guess that the NHS or the doctors and that just presume maybe you're just exaggerating because you are a woman. Especially as a Black woman, a woman of colour, there's a lot of disparities, there's a lot of systemic racism that we often experience.
Particularly as a South Asian woman, there is a lot of different biases about how community react to pain.
It was mentioned to me that because of my South Asian heritage, we tend to be more petite down there, and that could have been a factor in my pain.
You shouldn't have to be on the brink of suicide to be told, yeah, I can understand you're in real pain.
I ended up going sort of to A&E. I couldn't cope with the pain anymore.
Living through a medical menopause that was just invisible to the system was one of the hardest things I've ever been through.
I was given helpline numbers that no one answered, and many of the male doctors were rude and abrupt, making me feel invisible.
And at one point, my mental health was so bad that suicide seemed the obvious answer.
Once I'd had that appointment and knew what I was dealing with, the world felt a better place because I felt I had some control.
If I could design any interventions for the future, it would be more workshops and support groups about these conditions. Before finding Cysters, I had no one to talk to. Of course, I got friends, but if they haven't gone through the same thing as me, they don't always understand. They try to, but they can't always relate if they haven't been through it.
And just to make sure that, when we are going through labour and childbirth, that we're not just dismissed, we're not prevented from having pain relief.
In school, we're just taught about the menstrual cycle and how not to get pregnant, but you're not really taught about what is a normal level of pain to experience or heaviness of period.
There is poor gynecological and anatomical knowledge relating to different conditions or disabilities.
Having my access requirements clearly communicated when medical professionals make referrals would take away a lot of worry.
I would really like to see transparency and data sharing across the NHS that's up to date and accurate, so that we don't have to experience the same scan, the same data, the same bits of tests that we're already repeating in order to really receive the same information.
Diagnosis must be faster. Waiting lists are far too long, and a simple MRI scan can be used to speed up earlier diagnosis.
I wish there was a timeline given to people that have just been diagnosed, so we know where our file is. I was thinking, I'm going to have chemo, I'm going to have this, I'm going to lose my hair, I'm dying. Why does it have to take that long to give somebody more details about their diagnosis?
The biggest absence that we see within care is lived experience being at the heart of it.
You have to really be consistent and determined to get help, and almost have to constantly show them how much you're suffering in order to really be heard.
I feel like we need to be heard. When a woman says that there's an issue, it's not just, just an issue that affects her, that's an issue that affects the community as well.
It's a story of being dismissed and fighting to be heard, so all women's health is treated with seriousness and the urgency it deserves, and so that no one feels invisible in their own care.